Okay, let's talk about our patient today.
Our patient today is a dentist.
Young lady, a preeminent lecturer,
A dental hygienist.
from Bulgaria,
Buffalo, New York.
Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers,
8 Lumineers.
10 Lumineers,
6 Lumineers.
10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient.
And now we're not treating teeth anymore. We're treating smiles.
Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that. Okay, I'd like to say good morning to the good folks in Oklahoma. Now, what Lumineers does is allow you to practice the most conservative dentistry and give people the most attractive smile. So we now have a foundation, and we can do something we've never been able to do before, and we can do it for people with bridges and crowns, and we can do it. In fact, this patient has one porcelain crown on her bicuspid on the maxillary right side. It's going to mean no big challenge for me to do that because it's a matter of surface preparation. So I start out with a knowledgeable assistant. I don't know how many, 20 some odd years you've been with me now. So let's take a look at what Lisa's got on the tray. Everything you need is in that little plastic box. See it right back here? It's all in here. Now we're going to go through how we treat the surface. Lisa has put porcelain conditioner on those pieces of porcelain, Lumineers. And that's citric acid. That's an organic acid. Very important you keep this point in mind. Then she's got the Cerinate Prime, which is a silane. It's a one bottle, no mix. And if you're using these one bottles that don't have a conditioner on it, and that's all you do, the problem you have with that is what? The silane ages, and as it ages, the reactive sites of the silane copolymerize, and you can't form a strong enough bond. Now, by putting the organic acid on the surface of the porcelain the time you place it, that's when you get the most active, freshest, strongest reactive silane. So that's why we do this. And you'll see us doing that on her bicuspid on the right side. Now, how many of you use 4-power magnification? I highly recommend you don't work with anything less than 4-power on a patient, especially when I'm working on her without anesthetic, because I can see so precisely where not to touch. How many of you have a sapphire light? You're going to watch me place 10 Lumineers in her mouth in less than 1 minute because we have the sapphire light. Now, the next thing you want to do is get a good impression. We recommend the Invisalign technique. That's a double wash, and we use the Lumineers impression materials. And what you want to do when you take your impression is make sure that you're satisfied with the margins of the gingiva. Okay, Lisa has polished the patient's teeth with porcelain polishing paste, and we use that because it has an enzyme in there to dissolve the plaque on the teeth, so you'll get a better, fresher surface that you can prepare. So now we take the microetcher, and we're going to microetch her maxillary right first bicuspid to get surface preparation. And I'm using the microetcher to take the glaze off the porcelain. Now when I'm bonding to porcelain, I prefer not to remove more than I need to unless I'm getting contour. So now I'm putting liquid paint on dental dam on the lingual side of these teeth. Okay. And I got to get that blue paint off dental dam off that labial side. And where you have spaces, you've got to be very careful. Best way to protect your eyes is to close them. So I place the light, get it finger rest, and then I look away or close my eyes and push the button for 3 seconds. We're using the 9mm tip. Okay. And the reason I'm putting the paint on Dental Dam all over is because I don't want the Ultra Bond and the tenure and all that to bond to the edge surface on the lingual side. It really facilitates cleanup. Now let everybody take a look on the lingual side. And notice how I was careful not to have that go through the embrasure between the left cuspid and the lateral, and a little bit between the two centrals. Now we're going to do the next step in surface preparation. For the porcelain, we're going to put Porcelac. And Porcelac is hydrofluoric acid. Now, hydrofluoric acid is really nasty stuff. But this is buffered, and it has a pH of 2.9. Well, I like to suck it up first and then wash because there's less to wash around. And one of the places that you don't want to use hydrofluoric acid is where you have bleeding tissue. Now we're putting porcelain conditioner over this etched surface. What is porcelain conditioner? It is citric acid, organic acid. If you run out of citric acid and you say, well, we'll just use some regular etching agent, it won't work because phosphoric acid is inorganic acid. And then when you try to bond to that porcelain, if you use the wrong acid, you say, it doesn't work. Now what we're doing is using 25% phosphoric acid with aluminum oxalate in it, and it's called Etch and Seal. And the reason it is that if you're using it for your regular operative procedures, then the aluminum oxalate seals the dental tubules. Okay, ready to go? Then you can do what I'm doing. Surface preparation, bonding to the surface, and then finishing. See, these are all clear colorless liquids. And it's so easy to get one mixed up with another because if you don't do this in the right procedure on porcelain in the right way, you're not going to get a bond. And you're going to say you can't bond to porcelain. So you might be a great pilot, but if you don't have the skill sets for the airplane you're flying, a high-performance airplane is not difficult to fly. Those Blue Angels don't have any trouble flying those high-performance airplanes. However, they've had a lot of training and they have had a lot of experience to do that. So we just make sure that we've done this before and we apply the solutions the right way. Now what I've been putting on these etched surfaces of the enamel is tenure. And tenure AB is the best bonding agent that's ever been invented. And they've got all these other gadgets that they come out with and try to sell it to us. But what Ray Bowen did on this was something that nobody has been able to equal or surpass. And we've been using it for 20 years. So now I'm putting the two Lumineers on that are the same shade. But if you look on the screen, they're not the same shade. Here's the reason why. There's air between this porcelain veneer and the tooth. So the shade here is the shade of the etched surface of the porcelain. This is a shade with the Ultrabond Tri-In paste. And this Ultrabond Tri-In paste allows the light to come through and bounce back. Ultrabond Tri-In paste is exactly the same as Ultrabond with no activator in it. So we should always try these in, and I usually do it with 2 teeth only. Then we give the patient the choice, okay, of which shade she prefers. And I like to give the patient the choice between 2 shades. And when you're doing 8 or 10 Lumineers, the shade is really not that critical. It's when you're doing one trying to match everything else it's tough. So let's give the patient a mirror, and we'll find out if she likes the one on the right better or the one on the left better. The one on the right, okay? Now I'm going to take Tenure S, and Lisa's going to use a Tenure S to clean out the try-in paste on the 2 porcelain veneers. Okay? And then on top of that, I'm putting Tenure S on everything. Tenure S does 2 things. It cleans out the try-in paste, and it also coats the surface with resin. Has HEMA in it, and it also gets to the surface. Remember, whatever gets to the surface first wins. It's either resin or contamination. And in case you're wondering what I'm using here, this is a Lumigrip, and it just picks it up. So neat. I carry it to the tooth and place it. So Lisa loads them. We always call them off by name. Right lateral. But it really facilitates placing it. See, now I'm putting the luminaire over that porcelain crown. Now, one of the things you never want to do is put the Tenure S on when you're doing the try-in paste, because the Tenure S, in case Lisa doesn't get all the try-in paste out of those porcelain veneers, if she doesn't get it all out, the Tenure S will cause it to polymerize. Okay, I'm going to take the 2mm tip, and I'm going to stay 1 tooth from the most distal, and close your eyes and give it 1 second in the middle. And that's to have these get set. Close your eyes. When I place it on the tooth, I want to see a little Ultrabond oozing out all around the margins. Because when you don't have enough, it looks just like when you have the right amount. Close your eyes. And close your eyes. Close your eyes. Close your eyes. See, once you get that spot cure on there, that keeps them from slipping around. So now I take a cotton roll, dip one end in Tenure S, and I go wipe a lot of this excess off with this. Okay. So we're going to put 5 seconds on each veneer. Close your eyes. We're going to do 10 of them. And that's 50 seconds. And then we'll take 1 second to move from tooth to tooth. Now, I have people ask me, can you do 1 or 2 at a time? I've done that. You can do it. But then when you get the excess Ultrabond on the adjacent tooth, you got to clean it all up and restart. Close your eyes. And close your eyes. Remember, these have all been spot cured. And so we know they're down, and we know we had excess when we used the 2mm tip to. So I'm not telling you this is the only way you can do it. You can do them 1 at a time if you want. You can take 4 or 5 hours if you want, but you won't get a better result. In fact, is you may not get as good a result if you got this stuff polymerizing on the adjacent teeth. And now we're taking a Sure 349 and picking out the blue paint on dental dam. Why did we choose blue? So it won't look like the tooth-colored Ultrabond. And we're going to use this to clean up the labial surface. Now let's see. See how clean that is around those gingival margins? So now we're going to take off the excess. So the first thing I like to do is go on the occlusal surface, wide, and I'm going to blend the Ultrabond and the enamel all together. So I'm using that football-shaped diamond, and all of these things are in the clinician's finishing kit. Now, when did we start this? About an hour ago? And we've just done a half hour in seating and bonding, and we bonded to a porcelain surface as well as to enamel. Have you felt any pain yet? No pain. And I'm just blending the lingual side, removing the Ultrabond and the interproximal embrasures. And then I come over to the left side. Now we're going to go to the labial side with a 12 fluted burr. But notice I have a copious amount of water in here. And what I'm doing with this 12 fluted burr is removing the Ultrabond from the interproximal embrasures. I'm doing all this without anesthetic. And because I have so much visual control, there's very little bleeding occurs. So far there hasn't been any. And what I'm doing is getting rid of that Ultrabond from the interproximal embrasures. Now this is very important to get this Ultrabond out before you open the contacts, because with a lot of Ultrabond in there, you'll have a difficult time opening the contacts. So if you ever have trouble opening a contact, it's because you haven't removed sufficient Ultrabond. You know, if everything goes right, it's because you prepared for it. And right now I'm in these interproximal embrasures and I almost feel like I'm almost walking through them because I have so much magnification. I can't stress enough the importance of 4-power magnification or greater. And I'm just taking off this Ultrabond now in the interproximal. And I'm scraping across the labial surface. Don't use your hygienist instrument to do this, or you will scratch the surface. Now, if you scratch the surface or you want to change the emergence profile and you take the glaze away, it's a simple matter of using a dye-like cup with porcelain polishing paste and using a 30 fluted burr to smooth everything. 1 second, I want to call to your attention that we have some gauze there, okay? That we have bonded all these teeth, and we really haven't done any of the final finishing. We're just taking off the excess. So we just take the long, narrow diamond and blend that porcelain to the tooth like the enamel blends to the dentin. So now I'm just going to start going over here on the left side. And then I get into these interproximals, and I get that shoulder mostly removed. And because I have so much magnification, it's easy for me to see these interproximals and not hurt her. We can visually discriminate between porcelain and tooth structure and ultrabond. So you just do what makes it look good, and these dentists that are here will get a chance to take and explore and see that we have blended most of these margins to the tooth. But what I have done in the past and what I used to do is I try to get it all done on the placement visit. So you have the patient in, you try him in, you like him, you can go ahead and bond him that day if you want to. What I'm doing on this lingual side is I'm opening these embrasures some more with the Ultrabond, because when you watch me open the contacts, it's going to be a very simple thing to do. And now we're going to check the occlusion. Now we're going to have her put her teeth together and grind around gently. Let's see if I can show you this, what this looks like underneath here. See all the marks? There's no marks on her porcelain. There's marks on her natural dentition. Now let's have a seri saw here. I didn't get all the Ultrabond out. So I start sawing. Now, if I run into resistance, I don't saw harder. I stop sawing and I start rocking. See that? So I open all the easy contacts and then I let the patient go home. See that? That's how easy that was. And I didn't have anything in there, but I spent some time taking the Ultrabond out. Then when they come back, say a day or a week later, all the contacts that weren't opened start opening, and the ones that don't still have Ultrabond in there. So we work those out. So that second visit is really important. Now we take the seri sander, but there's one contact I'm not going to open. That's the one where we're bonding to porcelain, because silanated bonds, when you're bonding to porcelain, take about 24 hours to really reach their maximum. And I'll just show you how easy it is to open most of these. See? See, now what I'm using on this is a seri sander. And what this is doing is getting out the Ultrabond that didn't get taken out with the seri saw. You're using water, light feather touch. Okay. We'll give you a quick look at what's taken place in about 40 minutes. What you've experienced right here is what you could do. But look, just think about it. You know, we're having so much fun here, and we have changed this person's life so dramatically without the requirement to do all of that destructive procedures that we were taught. And remember, everybody, you can do it.
Well, I chose Lumineers because I wanted a new smile. I am a happy person. I love to smile, but I was always self-conscious about my smile. I heard about Lumineers. I had seen ads in a magazine, but I didn't know the significance of them until a friend of mine who has experience with them told me about them. And to be able to experience such a painless procedure and to have such a radical improvement in my smile and appearance is a dream come true. It's really a miracle. I'm going to be seeing my sister who lives in Hawaii. She's coming out this weekend, and I'm getting a little choked up. I'm so excited to see her. We lost my parents a few years ago, and this was something my mother had always wanted me to do. My sister has a naturally gorgeous smile, and now I will match her. So we'll know that Mom is looking down on us, and I'm very happy.